This is Thursday, and that means it's Bronson Health Chat time. And joining us today is Dr. Wade Kang, who is a vascular surgeon with Bronson Healthcare Midwest Vascular and Endovascular Surgery. Welcome, Dr. Kang. It's nice to have you here.
Thanks, Jim. Nice to be here.
Let me ask you about your role as a vascular surgeon. How do you help patients?
Most of the vascular diseases are chronic disease. We see our patients for many years and develop long-term relationship. The one thing unique about vascular surgery is we manage disease in both medicine and surgical ways. We follow our patients long-term. Patients come to us for management of vascular disease, not only for surgery. We will see our patient and decide whether patients will need surgery or they just need medication. For some part, we are a combination of both internal medicine doctor and the surgeons. We will discuss with our patient about their diet, their exercise, a lifestyle change, sometimes including smoke cessation. We also treat patients' disease with medicine like aspirin, Plavix, Lipitor, just name a few. And we'll make sure they have a best medical management for their disease. When patient needs surgical intervention, we'll treat their disease either with open surgery or endovascular therapy. When we will treat them in a timely fashion if they need to.
All right, so like I've been told that I'm in that age group, where I need to start, keeping track of that.
Right, yeah.
So what would be some of the common reasons that I would come see you as a vascular surgeon?
Some of the common disease are one of them are aortic aneurysms, which is enlargement of the aorta with like a balloon. And that's a very dangerous disease because once the aneurysm rupture, most patients die. And so when we see our patients in the office, we follow them closely to see whether the aneurysm need to be treated. And if not big enough, we just follow them doing either CT scan or ultrasound, doing them in a regular interval. Some other common disease are carotid artery disease, which is a narrowing of the neck arteries. And this disease, if untreated, they can cause stroke, which is very disabling to the patient. And we also see them in our office and follow them closely. And if they reach a certain point, we operate on them. And also, even after surgery, we follow them closely and make sure they have appropriate medical management, appropriate follow-up, and make sure they're on aspirin or a Lipitor. We treat them. And also, we see a lot of venous disease. When patients have varicose veins, they can have pain when they walk, or they can have bleeding or ulcerations. And also, we see the patients with a blood clot in their legs, and we can treat them with removal of blood clot, and so they can walk again. I would say most of the common disease we treat, we call the peripheral arterial disease, which is a disease of the artery supplying the legs, and the patient can develop pain when they walk, and they can have non-healing ulcers in their legs, or sometimes gangrene in their toes, like black toes. And if this very severe situation, if they not treated in a timely fashion, they can end up with amputation.
And I was going to say, and that can be complicated by diabetes, by high blood pressure, things like that too. So I imagine you probably have to keep an eye on those things too. We're talking with Dr. Wade Kang. He is a vascular surgeon with Bronson Healthcare Midwest Vascular and Endovascular Surgery. Let's talk a little bit about endovascular surgery because you specialize in a endovascular technique that's called limb preservation.
Right.
Can you tell us what that means?
Yeah. So. Which the endovascular means there's no surgery, open surgery involved. So there's no scalpel, there's no sutures. And so we use a sheath, make a little puncture in the artery. And through that sheath, we can pass a catheter or balloon or wire to reach, first do an angiogram to look at where the problem is. And then with all the modern techniques, the toys we have, we're able to bypass, to cannularize this and reopen the closed artery and treat that artery, either with a balloon or with atherectomy device, which is essentially a rooter, and we clean out the plaque and then reopen up the closed artery. And so angiogram, because angiogram is really minimally invasive, is a day surgery. Most patients can go home during the daytime, and not unlike open surgery, which takes 5-7 days in the hospital and a long time to recover. So my patients mostly recover fairly quickly. And also, there is 160 to 180,000 of amputations in the U.S. yearly, and study has been shown if they can do angiogram before the amputation, amputation rate can drop significantly.
Wow.
But unfortunately, data shows in 2012, there's 51% of patients who had amputation did not have angiogram before surgery.
Oh.
So there is really a lot of room for us to do angiogram to help the patients and to drop our amputation rate.
Now, so let me ask you this, Dr. Kang: is there a certain kind of patient that you would favor doing the the endovascular as opposed to regular surgery? I mean, as age-wise or risk-wise, things like that.
Yes, definitely. Endovascular procedure can have less stress to the patient's body, and the patient recover quickly, and they have because sometimes patients cannot tolerate the open procedures. They cannot tolerate general anesthesia, and as far as endovascular procedure is far more advantage for them.
Okay. Dr. Wade Kang with us. He is a vascular surgeon with Bronson. Well, let me ask you a couple of quick questions before we have to let you go. Where are you currently seeing patients?
I'm currently seeing patients in Kalamazoo area, and also I have an outreach clinic in South Haven. One of my partners, Dr. Vadanini, see the patients in Paw Paw and Three Rivers. We have a 4 vascular surgeon group. We have Dr. Bronson, Dr. Vadanini, and Dr. Armin Pers recently joined us. And so we have 4 vascular surgeons. We can provide comprehensive vascular services.
If we have a listener out there and they think that maybe it's be a good idea that they saw you, how do they make an appointment?
We do need a referral for our appointments, so they can talk to their primary care doctor and then call, and they can make a referral to see us.
Okay. Now, is there some place that people can go to get more information about the heart and vascular care that Bronson provides?
Yeah, listeners can learn more information about our heart and vascular program at bronsonhealth.com/heart, or they can call toll-free number 855-338-7654.
Wow. Dr. Wade Kang with us. He is a vascular surgeon at Bronson Healthcare Midwest, vascular and endovascular surgery. Dr. Kang, thank you so much for taking time out of a busy day. This is fascinating. I really, and this is something that touches a lot of people, obviously, because, vascular disease is because of our lifestyle and, and genetics and things like that, it's become more and more prevalent. So it's nice to know that you and other surgeons are around to help us stave off this a little bit, I guess. So
you're welcome.
But thank you very much for coming in. We appreciate it very much.
Thank you.
590 WKZO, it is Kalamazoo's Morning News.